Good morning. This is Francisco Jose Caicedo, your applicant for the clinical biomechanics and orthopedics area. Being an orthopedic surgeon about 36 years ago, I'm an American orthopedic fellow, American board orthopedic surgeon, member of the Colombian Orthopedic Traumatology Society. We're living a challenging time. And I think this is a great opportunity to have a new look in the way we approach medicine and the way we approach our patients in order to improve the care and the final outcome. After being involved in care of the patients for many years, almost 40 years, and have these opportunities to have a pause in my practice, although I'm still in practice. Actually, today, Sunday, I'm on call and it just come from surgery, make me realize that we need to prepare for the future in medicine. Start the way that we interrogate the patient, the way we get information. The electronic medical records that we have currently are very primitive, produce clonus information, but not really translate in a good care of the patient and create time consuming for the clinicians. The names and the approaches that we have for different diseases in the musculoskeletal, they need to be modified. Why university like you is a pioneer and very respectable around the world due to the work that has been led by Dr. Soren Overgaard, Janice Lorenzin, and also Marianne Lundengard, Niels Dieter Rock. You've been creating information the strongest in the world. I mean, the production that you have in data statistics are very strong. So they create a great foundation. But now with this challenge, we need to go furthermore. My vision is to pause in my surgical practice and the clinical practice to focus in this time of my career and really design and have a new look in the way we approach our patient and how we treat it with no surgical and surgical treatment. So we start with the way that we collect the information, passing for the diagnosis test, and also with the information we have in our data, we're able to reassess the outcomes of some procedures. But my approach go furthermore. My idea now is to reassess every single diagnosis and treatment in orthopedics. So for example, you will see my videos where tarsal tunnel syndrome, posterior tibial tendinitis, they are not a unique entity. They are part of what I call the neuromechanic syndrome. It's not only worse, it's the way that we attack the problem. We really need to reorient or reinvent the medicine in order to get better results. So we need to be able to treat the complication before they happen. So it's like the movie in Minority Report where there were special mind readers to detect potential crime, but we're not looking for punish nobody here. The idea with this one is to be able to read minds in the aspect of the health diagnosis and treatments with the hope that we're going to have less complication and less severe complication before they happen. So in order to do that, yes, you have the best basis in the world with the outcomes and with the tremendously high quality studies, but also we need to do anatomy studies. We need to reinvent the surgeries, the approaches that we're doing, the biomechanical results, and then we can test it and prove it in our orthopedic community. So it's a big effort that it will require the involvement of biomedical engineers, PhD, polyhealth, and orthopedic surgeons, to achieve our goal. So not only we're going to be pioneers in the diagnosis in the orthopedic treatment, but also in the technology. We can invent new instrumentation and new surgical approaches for this complex problem with the hope that we can have a better outcome and predict and prevent complications. So this is my vision and this is my contribution. I know I'm the non-conventional candidate for you, but I have a very strong background in orthopedics. The fact that I've been training in University del Valle as a physicians, full training in traumatology and orthopedics in Universidad del Valle, Cali, Colombia, and then back to United States, do another internship and complete a 6 years orthopedic residency in University of Alabama, Birmingham, and plus have a full fellowship with Dr. John Gould in American Sportsman Institute, give me a good qualification, plus the thousand of patients have been treated surgical and non-surgical in orthopedics. Most of them, I feel comfortable that I was able to help. Some they didn't make it, and the other ones, they were not happy with the outcomes. So in memory and also in to be thankful for those patients that I was not able to deliver what they were expecting. That's what we're looking to create this new era of treatment, diagnosis, and technology in all the levels in orthopedics. And I have a strong background now with musculoskeletal ultrasound. And I think this is one of the armamentarium that we should use, and every single orthopedic surgeon must be training and be familiar. And we can start doing investigation, research the combination of surgical techniques involving ultrasound, the arthroscope assisted, and of course the traditional radiographic studies, C-arm, fluoroscope, and arthroscopy and radiograph in surgery. So hopefully you can understand my philosophy and my vision. And in this one is going with your goals, I will be your best candidate. Thank you for this opportunity to give me to express my ideas. So to improve quality of life and function of patients with orthopedics and related problems through innovation of surgical and non-surgical treatment, that's exactly my reason where I become a medical doctor and later on orthopedic surgeons. Like many patients with different challenges, we have patients with diabetic. You can see the absence of bilateral hallux, where the tissue was not good enough, but we use flaps to use part of the plantar to recover the defects and also improve functionality. Other patients with a motor vehicle accident, would they have a severe open fractures, compartment syndromes, with the help of our knowledge, the anatomy, and the training, we were able to stage it and save the foot and the life of this patient. And occasionally, we have some challenge, like this patient you can see, this unfortunately patient has a bilateral knee amputation, became bilateral, come after he fell from the wheelchair, has a fracture in the trochanteric area. So we have to adjust it to this strain and difficult situation in able to reduce and produce a fixation. In this case, we use TFN, transtrochanteric femoral nail with a spinal braid in order that the patient continue his activities. Intraarticular upper extremities, radial fractures, open reduction, tendon fixation with volar approach, volar plate, ankles with a severe comminution, tibia plafond, and three malleolars with fixation. Patients with non-telos, where we have to customize to a 3D reconstruction, CT scan, and then customize the telos in this situation. Tissue that we always address, ligaments, flexors, tendon. This is a worker comp patient who fell from the ladder, sustained an injury. This is the lateral side, rip off all the lateral complex ligaments. sustained open dislocation of the ankle, underwent fixation, lavage, irrigation, and debridement. Being a smoker and diabetes have a big complication with necrotic of the tissue, after debridement, wound back, and believe it or not, skin graft were able to achieve the result when the patient is ambulatory. Still dealing with diabetics as a neuropathy, but he saved extremity and he's part of the activities from work. So to get familiar with me, I'm a 62 male married with 7 children. I was born in Cali, Valle, Colombia, South America. Currently, I'm a United States of America citizen, and living in Birmingham, Alabama. I've been an active medical doctor continuously for 39 years, and I've been an active orthopedic surgeon for 34 years. My hobbies are soccer. I'm a salsa music composer and a dancer. And this is my family, where my sweet wife, she is owner and the CEO of the organic products, my Rainberry, and also she's a painter. My oldest daughter, she's in San Francisco. She's an opera singer, training in Alabama School of Fine Arts in voice. My other daughter, Juliana, she's a Broadway actress in Richmond, Virginia. Daniela is a student now in the University of Richmond, Virginia in visual arts. My son is a high school, elementary going to high school. He's a piano player. And also he helped us with the little 2 princess at home when mama got busy. In hobbies, I compose salsa song, Mi Arrocito en Bajo. This is the group of the musicians to help me to create my hit, and we presented in one of the Foot and Ankle International Society meeting in Cartagena. This is the group of dancers, so I invite you to listen to the song in YouTube. Soccer is my next passion. So here we can see George Jelnovak. He is the coach of UVA. This is the coach for the Su-17 United States. Actually, he's from Colombia. Here I'm with Juan Roman Riquelme. He's an Argentinian player from Boca Juniors, retired. To me, was one of the most number 10 best players in the world. And of course, my team, I'm with Cuadrado. This is when I was part of the team physicians in the NCAA Cup when we became a winners in 2009. So what is my qualification and expertise? Being graduated from Universidad del Valle, got the honor to have the Dean of Medicine, Dr. Rodrigo Guerrero, in 1981. Continue my education after service in rural year, mandatory 1 year in a small town, and work in sugar mill. I was the medical director. I graduated as an orthopedic surgeon under Dr. Jochen Gessner in 1987. Moved to the United States due to the instability in Colombia. We have a big problem, like it's well known around the world, with guerrillas and drug dealers. So my family has to move and restart over. And I was fortunate to be admitted in the University of Alabama at Birmingham. And after 6 years, I finished my residency under Dr. John Cochler, chairman of the department. Went to a small town in Lebanon, Virginia, catch my breath, and okay, I will continue my presentation. I just got a call. I have a patient that's going to need a below-knee amputation. We do it in the morning after medical clearance. So continue. I got my training in Alabama School of an American Sportsman Institute under Dr. John Gould, Foot and Ankle. This gentleman had the privilege to